Omaha's news leader. This is KETV Newswatch 7's Chronicle.
Good morning and thank you for joining us. I'm Bill Shammer. The Omaha Division of the Drug Enforcement Administration has a new special agent in charge. Dustin Gillespie is taking the helm. It comes at a time when synthetic drugs are becoming more popular, and the White House is aiming to stop illegal substances from coming into the United States. This morning, we're sitting down with Gillespie to talk about his goals for our area and what concerns he has about the types of drugs in Nebraska and Iowa. Plus, how you can help by safely getting rid of your unused or expired prescriptions. First, a little bit about Special Agent in Charge Gillespie. He joined the DEA as a special agent in 2006, started in the Phoenix Field Division. There, he focused efforts on the southwestern U.S. border. In 2014, Gillespie moved to Quantico, where the DEA trains agents. He's also worked in Utah and now Nebraska. He's worked in special operations, high-intensity drug enforcement, coordinated investigations in several areas targeting gangs and drug traffickers, and helped with new systems for intelligence between law enforcement. Here's a look at the area covered by the Omaha Division. It is not just Nebraska. It also includes South Dakota, North Dakota, Minnesota, Iowa, and even part of Illinois. Special Agent in Charge Dustin Gillespie joins us in studio now. Thank you so much for being here.
Thank you, Bill. Thanks for having me, and it's a pleasure to be here.
I know it's a simple question, but there are so many acronyms in law enforcement. DEA, what is the job of the DEA?
Well, the job of the DEA is our middle name. So we're the Drug Enforcement Administration, and we are focused like a laser on the enforcement aspect of it. That's what we do. We investigate drug trafficking at the highest levels. We work cases that start here in the Midwest, and we build them down to the southwest border, across the border into Mexico, and then across the globe.
A little bit about you yourself. Why the DEA? I know you were in the Army, so why did you go into drug enforcement and investigations?
I think it started in the Army, that call to public service. That's important. I felt strongly coming out of the military that I wanted to do something in public service. I did not come from a law enforcement background. Many in the DEA do not. And that's how I got in. So I applied to all the three-letter acronyms, and fortunately, DEA came calling first, and it has been an incredible career.
You have lived in Arizona, Utah, Virginia. You're from Alaska, is that right?
That's right. I grew up, born and raised in Alaska.
Where did the desire for service come from?
I think it's like I said, it started in the military, being amongst the soldiers, the officers, that love of country. I loved having meaning in the job that I had. You're not going to become wealthy or rich in the military or in public service generally, but that's not the most important thing. At least it wasn't for me. And so I knew that when I transitioned out of the military, that I wanted to stay in public service. I wanted to have a job that had meaning and made our communities better and safer.
How's Nebraska measure up so far?
It's been incredible. And first I have to say that the people here are top-notch. This is the best place to be amongst the hardest working, the most driven, the kindest people. I think that's the reputation of the people in the Midwest, and it is 100% true, and that's been my experience since landing here in September.
Right now, there's a lot of focus on the country's borders, on the southwestern border specifically. You worked in Phoenix. What's going on at the southwest border right now?
That's right. So I started my career on the southwest border in Phoenix, in the Phoenix office, and I have to say that working in an office on the southwest border is the best place to start a career in the DEA. That is the front lines of our fight targeting synthetic opioids right now, fentanyl, but all the other major illicit drugs are coming across the border there on the southwest border. So that's the place you want to start. And I was fortunate enough to have that initial assignment out of the academy. And those investigations, like I said, they're front lines. So you can swing a dead cat and you're going to hit a cartel member there, a Sinaloa cartel member. Now we're seeing a lot of CJNG, Cartel Jalisco New Generation as well. But those investigations target right out of the gate the highest members and the highest levels of cartel leadership.
Is it the same as it has been for the last 10 or 15 years, or have things changed over the last couple of years?
I would say a lot has stayed the same. The cartels are in it for the money. and they still traffic the drugs in very similar ways. They have to get the chemicals to produce the drugs into Mexico. They manufacture and synthesize those drugs. They have to throw them in vehicles to get them across the border into houses, and then they distribute them across the country. We have seen a lot of technology infused into that process now, and so that makes it especially complicated for law enforcement, certainly.
What do folks here in Nebraska need to know about the threat posed at the southwestern border?
Sure. I think the first thing they need to understand is that this is not a problem of the southwest border. This is not a problem of major metropolitan cities. This is a problem that is America's problem. It is across all of our rural communities. A lot of Nebraska is a rural community. We have a lot of agriculture in our state here. Fentanyl is there. Methamphetamine is there. All of these illicit drugs are there in our schools and our communities. And that's the first step, is to get that message across that this is not something that we can ignore or turn a blind eye to. It's here, and we're only one step away from the border. Like I said before, our cases may start here in the Midwest, but they always will take us to the border and then across.
Is that the primary area of focus, or are you guys also watching our northern border, our eastern coast?
So we're always looking for the greatest drug threat and how they're getting into the country. Right now, that's the southwest border. Certainly, we're always checking on our northern border. I cover the state of Minnesota. We have that border with Canada. We have a great relationship with our counterparts in the Canadian government. But right now, the majority of those drugs are coming across that southwest border, so that has a lot of our focus.
When we were reading off your impressive, may I say, biography, we talked about how you helped in the development of new information sharing systems. How has that improved multi-agency communication?
Well, I think it goes to show that we have really moved into a whole of government approach, especially under this current administration, that has really been pushed and emphasized to the greatest extent that I've ever experienced. Too often, federal agencies or state and local agencies, we often find ourselves working in these silos where the information sharing and the intelligence sharing isn't happening to the extent that it should. Those barriers are breaking down, and they're breaking down very quickly. So we're now partnering up. You're going to see DEA and FBI and ATF, all those three-letter agencies working hand in hand together and with our state and local partners to work these types of cases, these international cases that start here. Remember, the drug traffickers, they're polydrug in nature, meaning they traffic fentanyl, meth, heroin, cocaine, every drug in the rainbow, but they're also smuggling humans, they're also trafficking firearms, so that whole government approach is incredibly effective.
You and I were talking in the newsroom a little bit, but you've enjoyed the collaboration here in the Omaha area, correct?
Oh, for sure, and we have great partnerships already that were already here before I landed in this division with all of our federal partners, and I think that's what the public expects. They expect that egos get pushed aside and we tackle the mission, and we do so jointly, lockstep together. And that's been my experience thus far, is the federal partners, our state and local partnerships, they couldn't be stronger. Of course, that will be one of my priorities being here, is to strengthen and cultivate those partnerships and target the highest level of traffickers.
Dustin, don't go anywhere. Next on KETV News Watch 7's Chronicle, the concerns the DEA Omaha Division has in our area and what people should look out for. And later, the Drug Take Back Initiative, how you can get rid of your own unused or expired prescriptions.